think this morning has been very productive. We came here to the Mayo Clinic to learn from and engage in discussions with one of the world's leaders and innovators in the total patient experience. They've shared with us their clinical and their research and their educational policies. They've shared with us their passion, the way they create a culture of care, and how they start that from the inception of employment and maintain it throughout employment. They've shown us some very impressive statistics on their low turnover of employees. They've also, what we've gleaned between the lines is that they are an organization that is in competition for patients, in competition with other pristine and premier health organizations, and what they have to do to make sure that they remain competitive and make sure they remain a leader in patients' desires and referring providers' desires to have their care done at the Mayo Clinic.
First of all, thanks for having us out here at the Mayo Clinic. It's a thrill to be here and to have all these people with us. What I've taken away from the sort of enterprise level at the military health system is that you guys really are an enterprise. You're a branded, known commodity with a really strong ethic in patients first, and that's what we want to take away. So I really appreciate that as a key takeaway from our talk. And again, thank you for having us out here.
I think my biggest impression is that a lot of the challenges that they face here at Mayo are very similar to the ones that we face in the MHS. In fact, many of those slides, you could have changed Mayo and put in MHS, and you would have had very similar issues. The challenges they face, now there's some difference in the financing, of course, which is my area, but in many of the issues that they're facing, we have the same challenges. How do you put in an effective electronic health record? How do you go with your value proposition? If you look at their value proposition, their quality over cost proposition, it looks just like ours. So there's a lot of similarities between the two. And so I know for me, I was sitting making just tons of notes on ideas to bring back to the MHS on how they're solving some of those problems. And so I think the thing I'm struck with the most is not the differences, but the similarities.